Hello, everyone. Welcome. We are so excited. We have another guest for you. This is somebody who we met in our mastermind. We've talked about this is how the three of us got to know each other. And Dr. Beth has been part of our mastermind, but we really wanted to bring her on because of her knowledge in hormones and all of that. So I am actually going to turn it over to Dr. Beth. I am going to allow her to do her introduction. And also, Dr. Beth, let us know why you chose this path of medicine. Over to you.
Drum roll, here she is.
Drum roll, here we go. Thank you, Miss Michelle and Tracy, Guardian Miss Tracy. I'm so honored to be on here. My name is Dr. Beth Malley. I'm a naturopathic physician. I'm licensed in the state of Arizona to practice naturopathic medicine. I'm the owner and founder of Malley Health. I also have my own online program where I work with women to really help them take back charge of their own health. I think in medicine, a lot of us like to give our own power away over our own bodies, over our own health to doctors. And I like to kind of give that power back to women and really make them responsible for their health, right? Because all I can do is be the vessel of knowledge, and they really have to do the work. And so really taking, the word doctor, docere is what it is in Latin, and that just means teacher. So I really take that to heart, and I do a lot of teaching, which is why I love my program. So I really work with women to, who are burnt out, who have hormonal dysregulation, and I really teach them how to balance their hormones naturally. I teach them how to really get out of that fight or flight stress, constant stress situation, and get more into the rest and digest. Because that's where a lot of our issues come from, right? Is that we are constantly in fight or flight and we don't even know it. So really kind of getting them to a place where they're like, oh, I actually recognize when I'm experiencing stress, when I'm experiencing that fight or flight response. What does it look like? Is it I get quiet? Is it I eat more? Is it I snap at people? So really recognizing what the triggers are, what the signs are, so that then they can not only be aware that they're in it, but then take themselves out of it.
That's really interesting that you said quiet, because I don't think of that when I think of stress. Like, I just assume everything is like, but that's really interesting that you could go quiet because of your hormones and the stress related. Interesting.
Yeah. And I know for myself too, before I really realized I was in a constant state of fight or flight, I would pull back, even from my husband. Like, he would be asking me questions and I would just shut down. So that's when I really realized, oh, this is a stress response. So all of us have very different responses. So really figuring out what's your trigger, how do you respond to that trigger, and then changing that, so being able to actually cognizantly respond versus just react to the situation.
I imagine that. Oh, sorry, go ahead, Michelle.
Dr. Beth, why did you take the natural path? I think that's a very interesting story. So can you share that for a little bit, and then we can go on to some more questions?
Yeah. So I knew that I have always been in love with science, biology, all of that. I mean, I know from a time when I was little, my mom she used to work in labs. She was a phlebotomist. She had, science books. And I would look at the books and they would have, blood cells under a microscope. And I would be so fascinated with like the fibrin and the blood cells. And I'm like, this is really cool. So I always had a fascination for that. As I grew up, I knew that I wanted to do something in the science industry. And I got my undergrad in public health because I knew that I wanted to work with communities. I wanted to work with large groups of people. And I worked in a pharmacy to kind of get myself into that area, right? So I worked in 3 different places in my undergrad. I worked at a public health association here in Arizona. I worked at a pharmacy. I worked at a physical therapy office because I wasn't sure what I really wanted to do. So I was pharmacy tech, and then I was also doing physical therapy, assisting, and learned that I hated physical therapy, not in the sense that, oh, it's awful. It's just, I didn't want to be that repetitive, right? I wanted the flexibility to do whatever, have different, just move differently. And so it was good because it taught me I did not want to go to school to be a physical therapist. While I was in the pharmacy, I knew that I wanted to do more. I knew that we could do more. I just didn't know how, because I would see, legal addicts essentially coming in for opiates for chronic pain. I saw, children coming in on depressive, they were depressed and they were on antidepressants. They were on, anti-anxiety medications, and they were just, anywhere from 5 to 12 years old. And I thought that was just awful to see children so young being put on such strong medications. I saw people coming in and getting antibiotics every other week, it seemed like, the same person. And so I knew that this really was not natural. It was not normal. And I knew that I could do something a little bit more for them. So I was pretty discouraged because after undergrad, I was planning on becoming a physical therapist. When I learned I did not want to do that, I'm like, well, I don't know where to go from here, but I know I don't want to go into pharmacy. I don't want to go traditional medicine route. And then, I kind of had a conversation with my mom, and she had told me about the naturopathic medical school in Arizona. And I was like, well, that's great, because I don't need to move anywhere, because I didn't want to move to Arizona. So I went and visited the campus, and it was just very warm, very welcoming, very nature oriented. And I've always been a nature baby at heart. Like, I could frolic in the woods and be happy. And so, yeah, it was just very inviting, and it was just a really good environment. And what I really fell in love with is that we focus on the root cause. So, and not to their disadvantage, a lot of medical doctors in Western medicine are taught in their textbooks, here's a symptom, here's a medication for it. We are taught, here's a symptom, these are the causes of that symptom, treat the cause, treat the root cause, treat the symptom. So instead of just shutting down the symptom, as if you see a car with a check engine light on and you're like, oh, I'm just going to clear that code, but you don't fix the problem. You just clear the code. And essentially that's what medicine is doing. It's just clearing that code. It's clearing that symptom, but it's not working on the root cause as to why that symptom is there. And so I think that's what was really fascinating for me, and what I really love about my profession is that I get to really look and see what the root cause is, because if we can treat the root cause, then you can actually prevent disease from further progressing.
Thank you. Thank you. Tracy, you had a question before I rudely interrupted you.
Yeah, no, I was just going back to the stress thing that you said. I just was thinking how interesting that is from a learning curve for people to understand what those triggers are in terms of what stress looks like for them. Because a lot of times we don't even recognize, like you said, that we have stress. I'm a perfect example of that. I thought it was like lived a stress-free life. I knew I had like moments of, stress like everybody else did, but I certainly didn't think that it was something that showed up on a daily basis until I recognized that, yes, actually it does. So that teaching that, how do you go about teaching people what to look for in terms of their stressors?
So what I really do is I break it down for them in a way of, journaling, doing workbooks, really just figuring out, okay, what's your stress, right? And that's actually a module that's in my program right now, is what is your stress? And so is it family? Is it relationships? Is it your animals? Is it money? And then further breaking it down from there, what else could be stressing you out? And I really teach them what the fight or flight is, right? What stress is. It's somebody pulling out in front of you in traffic. It's, oh, my water bill is higher than I thought it was going to be, and I wasn't prepared for that. Oh, it's my boss is yelling at me. You know, it could be, oh, I stubbed my toe. Really, there's no difference between a bear chasing you and you stubbing your toe. Your body recognizes that as the same stress. It has the same response. So really getting them to break down, okay, what is stressing me out? And then from there, that's when I'm like, okay, now that you know what your stress is, let's look and see how you react when you're stressed, right? When somebody's yelling at you, when there's conflict, how do you react? Do you attack back? Do you get really quiet? Do you shake? Does your throat kind of close up? Really having them put themselves in a, kind of bringing them back to a memory, not really putting them in that situation. But when we recall things, when we're playing things in our brain, our mind doesn't know if it's actually happening or if it's just a memory. So right to your brain, it's actually happening. So really having them recall that, really playing into it, writing down, okay, how do I respond? And every situation might be different too. In some situations they might fight back, and in some situations they might just, really clam up, get really quiet. And so just recognizing their different responses to different situations, when it happens, they're like, oh, hold on. I remember this. I'm reacting to a stressful situation. And then they can really kind of take a step back and look at it and be like, okay, no bear is chasing me. I'm not going to die. So let's, respond differently.
Yeah, that's awesome. That's awesome. And such a good tool to have, especially if that's taught at an early age. Do you work with women from all age groups?
I do.
That's awesome. Yeah.
Yeah.
I find that the availability of knowledge to younger women today is so much more prevalent. Like there's so much more knowledge available. And I think it's wonderful because I see there's more and more women who are willing to explore alternative ways of taking care of themselves instead of the traditional, oh, I don't feel well, I'm going to my doctor and he'll give me something to make me feel better, right? Like you were saying, that let's treat the symptom and here's what you need to take for that. And it's really, really empowering because just like you said, it gives people or gives women that ability to take control of their body and get to know their body. I know certainly for me growing up, I mean, I'm 65. I didn't know anything. Didn't know anything. If you got sick, you went to the doctors. That was it. Nobody ever talked about hormones except when you went into, the change.
Yeah.
That was like, oh my God, you're changing. Something's wrong with you. Your hormones are shot. And that was about it. That was the only time like hormones were really ever mentioned. If you got upset during your period, then you were, just called certain names and that's what you dealt with. And it was like no mention of there's a hormonal thing happening here. Like this is completely normal. This is what's happening to your body. So it's amazing. Can you tell us a little bit about your program and what it is that you are actually teaching women within that program?
Yeah, so my program, what I really stress about a lot in the program is stress, right? Because stress, we don't even know how much of an negative impact it has on our body. And I can kind of give you a little bit of background as to my own personal health story. When I got to medical school, I was so overworked, stressed out, burnt out. I didn't know what stress was. I mean, I went into medical school already stressed. And I didn't really know what that looked like. I didn't know how to recognize it. And eventually my hair started falling out. I started gaining weight. I couldn't lose the weight. I started having heart palpitations. I got really severely depressed. I was severely anxious. It's like something was wrong and I couldn't really put my, hand on it. And even though I was in naturopathic medical school, I did what everybody does. I panicked, I got freaked out, and I went to a Western medicine doctor because I wasn't really thinking It's just like, oh, like you said, Tracy, you get sick, you go to the doctor. And to a lot of people, doctor means MD, not NMD, right? And so I went to a Western medicine doctor, and at first they just told me, well, you're probably just depressed. You're probably just anxious. You can take this, you can take that. And I didn't want, prescription medications. I didn't want to take antidepressants and, anti-anxiety meds, because I just knew that it wasn't really what was happening. Finally, they ran some labs and they diagnosed me as hypothyroid. What they told me, though, is that I would always be on the medication and to get used to being fat, that I would always gain weight, that I would never be able to lose weight. So I was like, oh no, that's not happening. So I went to the doctors at school. I'm like, I don't know why I didn't go to you first. And, we really worked on the root cause as to why I became hypothyroid. And a lot of it had to do with burnout, had to do with stress, adrenal dysregulation, because I was so stressed out. My adrenals were starting to just give out. I was to a point where I almost was diagnosed as Addison's, which means that there's just no cortisol. So they really helped me work on stress management, in ways of nutritional medicine, yoga, getting exercise, things like that, getting hydrotherapy, really working on self-care. And 3 years later, I was able to come off of thyroid medication. I lost all the weight and then some. I did everything that the Western medicine doctors told me I couldn't. And so what I really focus on in my program is stress, really stress management, because the stress hormone cortisol causes so much damage, right? We need it in our body. We need norepinephrine for regular, physiological processes in our body. What we don't need, though, is chronic cortisol running through our system. That causes inflammation. It leads to autoimmune diseases. It leads to gut health. It really kind of eats up our gut health, right? So we might have a healthy gut and then we go to not having a healthy gut. It can cause a lot of different things. And, we have genes in our body that they either get expressed or they don't get expressed. And oftentimes stress can make us express genes that we don't want, like cancer, autoimmune genes. We could, shut down different processes. I was to the point where I was almost Hashimoto's, which is, the autoimmune hypothyroid, but I wasn't quite there. And even still, I have to, be very cognizant, because I was already almost there at one point. Every now and then I start shifting to that point and I'm like, okay, stress management, I got to work on this. So what I really focus on is adrenal dysregulation, because that causes a lot of different things to happen. So if we can really manage stress, that means we take away one, barrier to health. And we can actually start building our health from there. Because if we can manage stress, we can sleep better, we eat better, we can focus better. And so overall, we just become much healthier.
That it really is a domino effect, isn't it? You take care of this one thing, which automatically starts to affect everything else in your life. There's a lot of talk now. I don't know if it's entered my world, certainly, is this whole topic of gut health. What exactly is gut health? What does that mean?
Yeah, well, I can tell you mainstream media wants you to think that it's probiotics and that's it. And you have a healthy gut. And that's not what it is. It's stress management. It's, taking a probiotic if you need one, and every now and then I do up my probiotics. But we can get a lot of our nutrition to heal our gut from our food, right? What are we eating? With gut health, a lot of times an unhealthy gut can look like IBS, so diarrhea, constipation, or both. It can look like gas, bloating. It can look like, weight that you just can't lose, weight gain, quick weight gain. It can look like brain fog, chronic fatigue, hormone dysregulation. So really our health begins and ends in our gut, because what we eat, what we put into our body has to get absorbed into our system in order to feed the rest of our body. And then we have to excrete all our toxins through our gut, right? So really what gut health is what mainstream media isn't really touching on, right? It's not just a probiotic. It's really looking at what the symptoms are. How are you feeling? Are you chronically tired? Are you sleeping well? It can be anxiety and depression. Most of our neurotransmitters are formed in our gut by gut bacteria. Our serotonin and dopamine, these are feel-good drugs, I call them feel-good drugs. There are feel-good chemicals, right? They give us confidence. They give us the productivity. It also helps with bowel movements as well. You know, if you have too much serotonin, it can cause diarrhea. If you have too little, it can cause constipation. It also creates norepinephrine. So if you have your gut microbiome, which is all your gut bacteria, if that's not balanced, it can decrease your dopamine and serotonin levels and increase norepinephrine, which means that you're going to be in more of a state of fight or flight. And there's actually what scientists are calling our gut is our second brain. And essentially, if you were to sever the nerve going to the gut from your brain, if you were to sever that, your gut would still work without your brain. So it works independently of your brain. You have more nerves going from your gut to your brain than you do the other way. So really, when people talk about a gut feeling, it's actually your gut is sending your brain messages before your brain even recognizes something wrong. I don't know if any of you ladies have eaten something and you're like, oh, I'm feeling anxious, I don't feel good. And then you end up getting sick, 12 hours, 24 hours later. And it's really because your gut recognized there was some sort of toxin that entered your body and it was trying to warn you before it even happened.
Wow.
Yeah.
Wow. So the way I'm hearing you, I mean, this stuff is fascinating, first of all, like totally fascinating. I could listen to you all day. But what I'm hearing is that this is something that you have to learn, that you would teach your patients, right? And that it is a process. So how do you get around those people that just say, just fix it, I want it fixed now? Because we are such an instantaneous society, right? Give me the pill and I'll be okay. It's like, I don't want to have to learn this stuff for the next 4 years before I get better. Like, how do you handle that?
Well, before I even work with somebody, I tell them who I won't work with. And if you want an instant fix, if you want a quick pill fix, if you want, to go on a crash diet and do whatever, we're not going to work well together. Who works well with me is somebody who's really willing to learn their body, to learn proper nutrition intake, to learn proper stress management, to know that our bodies are not Amazon Prime. They are not going to be there in 12 to 24 hours. We are not Amazon Prime. We are not a text message, right? Like you said, Tracy, our society is very much so instantaneous. You can pick up the phone and FaceTime somebody. You can quick send an email and it's there instantaneously. And we expect our bodies to do the same. And so who I won't work with is somebody who wants the quick fix, the quick pill, the quick diet, the quick whatever. Because really, if you want true healing, if you really want true health, you're going to have to give your body time, because we've done so much to our body. Our bodies are resilient. We are incredible, but we abuse our bodies a lot. We abuse it by what we consume, be it alcohol, be it processed foods, be it just allowing stress to attack us at all costs, to just kind of put ourselves at the wayside to take care of our families. And so all the damage that we've done to our bodies, we have to heal that. And a lifetime of damage is not going to be fixed overnight. It's not going to be fixed by a pill. And so, who I really work with are women who are ready to have that true healing, to understand that it's a process, and to understand that you're going to have the up and down, and you're going to feel amazing one day and then be like, oh my God, I don't feel good today. And just understanding that, again, true healing is a journey, and it's always going to be a journey. I worked with a doctor who opened up the first naturopathic addiction clinic, and I worked with addicts in school and after I graduated. And one of his favorite quotes was, all there is the journey. There is no there. There's just the journey. Those who think that they're there have never actually started the journey. And it's so true. You can take that in any way of your life or your health as it is. When you really want true health, you decide, okay, I'm not going on a diet, but I am going to make sure that I'm giving myself nutrition, because guess what? I make sure that I get about a 90 to 10% good nutrition to, I'm going to have whatever. Like yesterday, I had a couple beers because I wanted to, because it was St. Patrick's Day. Every now and then, I just want a donut. And so just being able to treat yourself, but also knowing that most of the time, you're going to be feeding yourself nutritious food, right? And not going on this diet. It's actually going on a health journey, is what I really like to call it.
It's, this stuff should be like taught in high schools, like this alternative stuff. No, really it should, because the younger you are to understand that this journey exists, first of all, is so vitally important, so that women can take control of their bodies and their destinies. I mean, yes, there's probably places for the Western medicine when it's required, but it's like, knowing that there are these other ways is just like amazing. You're amazing. Okay, ladies, I hogged this whole interview so far. So like, over to you guys. Jeez.
I was just going to say that I have young daughters, not young, like one's in university, the other one's around the same age. And one of the things I try to teach them is learn your body now, because when you get my age, you at least have some benchmarks to know if you're doing well. So what advice would you give the younger generation? Like, what do you need to start looking at? Like you're saying, start to look at your stress levels. Like she's going through a lot of stress just because she's in university, and she doesn't, like, from a parent listening to your daughter, you totally know she's stressed out. She doesn't think she's stressed out at all. So what's some advice, just some, maybe a practical tip here or there that you would suggest to someone as they start their their life, and that they're going to keep this information going?
Yeah, one thing that I wish that I had personally started was to have somebody tell me, journal out your thoughts. What are you feeling? What are you thinking? What are you experiencing? Because there's something about the brain to hand pen connection where you're really getting what's inside your brain out into the real world. Like it's something that you can actually hold and look at. It's not just something that you're experiencing in your own head. So I think that one thing I would do is really, if you're not feeling stressed, but you're not feeling right? Like something's off, but you're not stressed.
Right.
I get it. You're actually stressed, but even if you don't recognize it, just being like, okay, how does this teacher make me feel? How do tests make me feel? Do I get an upset stomach before I take a test? Do I lose sleep before I take a test or before I go to a certain class? And then, really just journaling and getting those out there, because I think that will really help, especially younger people to realize, oh, there's a connection, because I didn't know that I had, IBS and, test anxiety. I was just like, oh, every time I have to perform, anytime I went on stage to do, ballet or sing or whatever, I would get an upset stomach. But I didn't realize that was stress induced, right? Because I never really made the connection. So I think had I started journaling and really keeping a score almost, and really kind of looking at, cause and effect, I think I would have recognized it more. Right. Also, really having somebody kind of help me, because I had a lot of FOMO. I think a lot of younger people have, the fear of missing out, which I call FOMO. And when that happens, we don't really want to rest when we should. Because I remember when I was younger, people, I would I would be sick, but I wanted to go to the movies. I didn't want to miss out on that movie. I didn't want to miss out on that time with my friends and everything. And I think had I really learned what stress could do to me later on, I would have been like, okay, Beth, take a step back, get some sleep, take a bath, get some rest, and really just allow your body to, you know, process what it needs to process. Because when we're stressed out and we're sick, good luck getting better. It's going to make it a lot harder, because stress will actually shut down our immunity. It'll shut down our ability to digest food. So I think if we can really get younger people to understand what stress does, what it shuts down, what it turns on, they would realize, oh, if I can actually manage stress, I'll be able to perform better in sports. I'll be able to perform better on my exams. I won't have to study as long because I won't have to brain fog. I won't have to read things over and over because, oh, I lose track. So I think if we really taught them what stress does and what the signs and symptoms of it are, they would do a lot better. And then, like you said, younger people absorb it faster and they're able to do something about it, right? Versus when we get on later on in our lives, we're like, okay, shit, where do we go from here? What do we do? How can we reverse this? And I think that it would just really help us in the long run to start younger.
And what you said about FOMO, are you finding the opposite though, that now that, like, I'm in Canada, so now finally restrictions and people are being social, are you finding people getting stressed about, I forgot how to be social. I forgot how to mingle. I forgot how to meet someone and say hi. And are you finding that type of stress too?
Yes, I would say very much so. Like social anxiety is coming up, right? Because we have been in a place where we've almost been taught to be fearful of other people. People are dirty. People are going to get me sick. I might die if I'm around somebody. So that brings about a whole new amount of stress for us. And so, yeah, I do think that there's the opposite of FOMO, where it's like, oh, I don't even want to hang out with you because something bad might happen. And yeah, I do see the opposite. And so really recognizing that too is like, okay, it's okay to hang out with people, you know, I can, and even if, you know, like in certain situations, I will mask up. I will be very careful around who I'm around or what I'm doing, but really just allowing yourself that ability to be like, okay, I can go see somebody, but I can do it how it makes me feel comfortable. Is it I'm masked up? Are we, you know, 6-10 feet apart? Are we on Zoom? You know, stuff like that. So I do definitely find the opposite is coming out, where people are like, I don't know how to socialize anymore.
Yeah. And you know what? That's so true. It's the expectations as well, because there are two sides of that story, which tend to be at like polar opposites. And what we all need to practice is a little bit of patience. Like for the people who are fearful, to be patient with the people who are all in, and vice versa. The people who are all in to be a little bit of, you know, offer a little bit of patience to those of us that are like, okay, you know what, I need to take this a bit slowly. So, you know, it doesn't mean that I'm not going to get there yet, but I'll, you know, just give me a bit, you know?
Yeah. Have a little bit of compassion for each other. Goes a long way.
Absolutely. Absolutely.
Dr. Beth, one thing.
I say anything.
Oh, you're fine, Tracy. One thing that you know, a lot of times the three of us, we talk about getting older, the menopause, the change, you know, women in general as we age. So you talk a lot about the stress management, and like a lot of things that you talked about that you were realizing between the brain fog and the gaining of the weight and all of this, I'm like, well, that's menopause, that's menopause, that's menopause, you know? So as a woman, you know, how do I want to say this? As a woman ages, and they might have a really good, healthy diet, but then start gaining that weight. Is there a time as we age that we always have to change our diet? Do we always have to like relook at our health diet and the food we eat and what we're doing because we age. You know what I'm trying to say?
Yeah, I think I do. So, and you can stop me if I'm not on the right track, but as we age, things change, right? Our hormones, estrogen drops. That's why we
Right.
get, the hot flashes. Certain hormones go up. We feel crazy. We start to experience the brain fog. Like you
Right.
said, we might start to gain some weight. Our testosterone might start to go down. We might not feel as energetic or as, sexually active as we once were. So I would say that as long as if you are eating extremely, like really healthy and you're working with, a functional med doc or, a naturopathic physician, and you're already like your gut health is on track, your hormones are on track, what you can look at then is, does your body just need a little bit of external support? You might go down the hormonal replacement therapy route. I find nothing wrong with that. Even getting movement, like working out for women, just a little bit of extra muscle helps to boost our testosterone levels. Just a little bit of extra movement can kind of give us that boost of energy that we're lacking, that we start to experience when we get older and our hormones are starting to change. But if it's really severe, right? Because it's really hard to have complete control over our bodies, right? Because we've got so many environmental toxins like pesticides and, smog and pollution and all of that. Like we have so much coming at us that even if we are the tip top, most healthiest person there is, we still have a lot of boundaries to, perfect health. I don't think that there is really a perfect health. So really, if you're very uncomfortable and you're just like, okay, I don't like how I'm feeling, I need some support, I think being able to go down the route of hormonal replacement therapy is not a bad thing. It can actually help to minimize your hot flashes. If you don't feel like doing that, you could even go to a functional med doc. There's a lot of different things that we can do in our arsenal that can kind of help with those symptoms and kind of help you to stop the weight gain, right? Not have to change your diet, right? Because especially if you eat really well, but you're gaining weight, it's like, okay, what am I doing wrong? And then you think that food is the issue when really it could just be, maybe you need a little bit more testosterone. Maybe your hormones just need a little bit more support. Maybe I just need a day and do some, therapy, like talk therapy or hypnotherapy, or going and jumping into an ice bath and really just resetting my autonomic system. I don't know if that kind of helps answer your question or if that was.
It does, because our body, I think sometimes I hear women say, well, I've been eating the same and I've never gained anything. And all of a sudden, pew, I'm gaining all this weight. And I know when I went through that, my doctor, even though I adored her, was like, get used to it. You're in menopause. And I do know my body composition has changed from when I was even at the age of 40 to when I was in my late 50s and the beginning of my 60s. But the thought of being told, just get used to it, was extremely frustrating to me. And I don't want people to think that they have to give up. So it's natural for your body composition to change, is what I'm hearing you say. And that's a normal, but you don't give up on your body.
Yeah.
And
you don't have to feel bad if you don't want to experience the hot flashes. I feel that I've worked with a lot of women who feel that they have to suffer through the hot flashes and the menopause and go through all the, what they call the icky change and the horrible symptoms. And really, it doesn't make you any less of a woman to get support if you do not want to go through that. It's just like a woman wanting to do natural childbirth versus a woman who wants to do an epidural. Really, it's what is right for you, and nobody else has any business telling you what is right for yourself. And so I think I'd love to just kind of speak to women and just say, give yourself that permission. If you feel like you want to suffer through, if you feel like it's not that bad and you don't need the support, amazing. If you feel like you want the support, you want to go to a doctor who is, very well trained in hormone replacement therapy, and you want that support, I say all more power to you, and really go do that. I think really society has kind of made it to where we should need and want the same things. And that's not true.
Right.
I think,
And I love the way that you say that, because I'm going to be completely transparent. I am on HRT, and I have been for the last 7 years. And it wasn't something I went into my doctor to get. I happened to be in the doctor's office and went into a full-blown hot flash. And I was not a lucky woman with my hot flashes. They were extremely to the pure wet. Sweat was rolling down my forehead, down the side of my face, and down my chest. And she's the one who said to me, this is a benefit for you because the symptoms that you are having are so extreme. And I was, as you know, and the Tracy's know, my whole health journey is different. I try to be as natural as I can be for myself. And I was like, no, I don't want to be on this constant medication. And it took a while to talk me into this medication. But the change that it gave me was astronomical. So I understand that I was a person who was so against it, but I had such extreme hot flash symptoms that she's like, and I was in the beginning stages of the 1 year off of my period, my menstrual cycle. So I was just really going into those extreme hot flashes. And she's like, it's going to get extremely worse for you. And I do have hot flashes throughout, but this here helps me through them. Does that make sense? Yeah.
It does. And I think that's really great because it shows that you were once somebody who was like, nope, I'm going to be all natural. I'm going to suffer through this. I'm strong enough to do this. And then you're like, nope, I don't have to feel this way. And I think the fact that you were able to not only change your position on that, but really just relax into it and be like, okay, actually, I don't want to make my body feel this way, I think is really beautiful. Right. And I think it's going to help a lot of women give themselves that permission too, because I think that hormone replacement therapy, even though it's something that's kind of getting bigger, it's still stigmatized by a lot of people. And I mean, I even myself, I'll tell you, I'm on HRT, because I had so much stress at such a young age, my ovaries gave out. Like I'm infertile, which is fine. I never wanted kids to begin with. But at the same time, even my doctor's like, no, we need to put you on some progesterone. We need to put you on a little bit of estrogen. You're going to feel better. And I think that what a lot of the medical community doesn't realize is that, okay, so like progesterone, it's not just for our female sex organs. It's also our brain needs progesterone in order to think correctly, to not have that brain fog. So, I think it's something that's still a little bit stigmatized. And I think talking about it more will help more women to feel comfortable to be like, oh, it doesn't make me any less of a woman that I need help. And it doesn't mean that you're going to have to be on it forever.
No,
I didn't have to be on thyroid forever.
Right. My next appointment's in 2 weeks. And every year we have a conversation about, do we progress on? Sometimes I have been off for like a 5 to, I think it's like after 3 months, you start to, it's out of your system or something, it's come out of your system. And I've had to go back on, but I started to deem it more as a tool in my aging process, because I do make sure, I always preach about the movement of the body and as you talk about the stress levels and all the other things that come along with menopause. I just use my HRT treatment. It's just one of my tools that I have in treating menopause. I don't use it as a cure to my menopause. I use it as a tool, and then do the mind work and the stress management and the, we have always talked about the hydration and the fuel your body and the natural ways of that. So I look at it as a tool, not as a cure.
Yes, absolutely. And that's exactly what it is. It's just another tool to help you to be your best self, to feel your best. And I think that's good that it's not a cure, it's a tool.
Mm-hmm.
And that's really important, because I know HRT, certainly growing up for me, because I went on HRT for a while, and then everybody was like, you have to get off that. You're going to get cancer. That's it. You got to get off that. And I think it gets a really bad health rap. And I unfortunately got scared enough to go, okay, well, I'm not going to take this anymore, because this is not what I want. I regret that decision. I'm probably going to investigate HRT again. But it's it has had a really bad rap. And it's like you said, though, Michelle, it's something that it's a tool to be used. Right. And when you know your body and you have these tools that you can use to assist in your evolution, why wouldn't you take advantage of that? Really.
Right. Exactly.
I'm not on it, but my mother was. And when she went on it, we all flipped out. We literally flipped out because of exactly that. All the science behind it at that time was crazy. And it did do weird stuff, but the technology and science nowadays is completely different. And I think people have to understand that you're not talking about 30, 40-year-old stuff here. You're talking about stuff right now. And I think that's a huge difference that people forget, at least my age forget.
Yeah. And it's true. And, in the past, it did cause cancer, the certain form of the hormone did cause cancer, cause breast cancer, but like you said, Tracy, really just the fact that science has progressed, and just to be able to remember that we are always progressing, to not to stigmatize something just because once it was this. It's like blaming somebody for who they were in the past versus now. They're completely different, right? They've evolved over time. So it's definitely still something that has a little bit of a stigma, but it's coming to light more and more women are being more accepting of it. The medical community is being more accepting of it. And I think it's great. I think it's a really good tool. Like you said, Michelle, it's a tool, right? It's not a cure. Just like I know it's just a little bit of support to give my body so that I'm not stressed out, right? Because we can do all the stress management, the mindset work, the, eating healthy, but if our body still needs support, we need support, in whatever way it is.
Absolutely.
Yes.
Yay for support.
Yeah, support. We love that support.
Dr. Beth, we're getting close on an hour here, so we don't want to take too much of your time. What would probably be your top 2 to 3 pieces of advice you would give a woman who really wants to take a natural path into their health? Where should they start? What should they look at? And, where does it all begin? Because it can be overwhelming.
Yes, it is very overwhelming, especially if you're doing it by yourself. So the first piece of advice I would say is find a person who is trained in either functional medicine or a naturopathic physician. And I will say naturopathic physician versus naturopath, there is a huge difference. A naturopath is somebody who went online and got a certificate, has no clinical or medical experience. They are not licensed by any medical board. Versus myself, I went through a 4-year accredited naturopathic medical school. So really finding somebody, number one, who's accredited, who has the training, the clinical, the personal training that they need, where they can run labs, they can really help to navigate the area of natural medicine, because it is so vast and there are a lot of people that try to be very misleading to, just get your money versus helping you.
Right.
So number one is finding somebody who has that training, has the accreditation, and I can even send you, if you have, notes or whatever, I can send you a link that they can look at to make sure that somebody went to a medical school, has a medical license to practice medicine.
That'd be great.
Yeah. And number two is to not do it on your own, right? So this goes back to number one, is don't listen to Dr. Google. Don't search your symptoms. Don't try to do the, new fad diet, any fad diet that comes out, ketogenic, Atkins, paleo, any of that. I say run the other way. Anybody who, like a whole crowd that's running one way, you should be running the opposite way. So really, don't do it on your own. Really find that person that's going to be there to support you, to help you to navigate. And really, another thing is interview your doctor or interview whoever you're working with, right? Because for my clients with my online program, I make it very clear, because it's over state lines, right? I make it very clear that I am not their primary care physician. What I am more is a health consultant for them. I give them the knowledge, they have to do it, but they also have to talk to their, naturopathic physician or their functional med doc that they're working with before they make any changes, right? But just making sure that they work well together, because you and I, Michelle, might work really well together, and then Tracy Gurney, you and I might not work well together, and that's okay, right? I know, I don't know why I picked on you, but but really just interviewing your practitioner, your person that you're working with, to get the knowledge, because it's okay that two people do not work well together. I think what happens a lot, again, kind of goes back to the beginning of this interview, where I talked about how a lot of people put doctors on pedestals. They give all their medical power to their doctor. They're like, oh, I can't take that supplement without asking my doctor. I can't eat that food without first asking my doctor. So really taking charge of their own health and noticing when there's medical gaslighting happening, right? Like if you're saying, I'm experiencing this, this, and this, and they're saying it's all in your head, that's medical gaslighting, and you should be running and finding another doctor. If you are asking your doctor to run labs and they're refusing, find a different doctor. Really finding somebody who's going to sit there and listen to you and believe you, because even though I'm a physician and I have the medical training, I do not have the, years of experience, what it's like to live in your body, Michelle, in your body, Tracy, in your body, Tracy. I do not know what it's like to be other than Beth, right? Yeah. So if somebody's not going to believe you, run the other way. So number one, find somebody who's actually trained, right? Not just a naturopath that, and God love them. They are doing some wonderful things, but sometimes they can, hurt people because they lack the training. So really, number one, finding that person that's really well trained, has a clinical and medical experience. Number two is finding somebody that's going to listen to you, right? And not do it on your own. So don't listen to Dr. Google.
I love the fact that you said to interview. We've talked before in our past programs, in my story about how I had to find a therapist. And I tell people it took me a while to find the right therapist. And we don't interview doctors, we don't interview therapists, but we'll change a hairdresser because they cut our hair wrong, like that. And the most important people, we take them on a pedestal, or this is what they said we had to do, or that's what you had to do. So I love the fact that you told us to interview our doctors. And, you talk about that, your gut feeling, I always tell my boys, follow your gut instinct. Like if your gut is like telling you something and your brain's not telling you it, I've always told them, run, because that gut is telling you something for a reason, so I love that you said that. And yes, I'm sure we can put, I think we can put that link in our notes. Can we,
Yes,
Tracy?
absolutely.
Okay.
Perfect.
Tracy Gurney is our technical wizard.
Tracy's all technical. Anybody needs technical stuff?
We go to her.
She's the gal right here, down here.
I
Dr.
love it.
Beth, you've been amazing. I just love this stuff.
Yes,
I want you
yeah,
back. We all want you back.
honestly.
We want you
Yes.
back.
I would love
Yeah.
to be back.
Yes.
I
I was-
love talking
I
about
was
this.
thinking of the same thing. I think we probably will all, the three of us will sit and chit chat, and even yourselves, Beth, if you think there's something that you really think, especially because we love, our whole goal through this whole process was we wanted to make women feel comfortable in who they are, in the changes that they're going through in their bodies. And the three of us were talking one day that it's not always something that you talk about with menopause or changes. We've talked about as we age, when we go through different stages of feeling invisible when we walk in a room. We talked about the weight changes. We've talked about brain fog. Definitely, we'd love to have you back.
Thanks for watching, and we hope to see you as a regular member of our community.